Hi, it's Jessica DaMassa. I'm here with Nhat Ngo. He is the Executive Vice President at Omnicell for Marketing, Strategy, and Business Development. Great to have you with us.
Great to be here, Jessica. Thanks for having me.
Okay, so we are talking a lot about the future of the pharmacy here, and one of the things I wanted to talk about is Omnicell's approach in terms of bringing in other partners into the fold. So I understand that you guys have just announced a deal with a company called KITT Check, which is a startup. So tell me a little bit about this. Is this the first time you guys have partnered with a startup company? I mean, what brought this about?
Yeah, we're very excited about the partnership with KITT Check. It is the class-leading technology for diversion, and it's using an AI machine learning to detect diversion in health systems, and we're really excited to add this to our portfolio. I think when it comes to diversion, it's a big problem for health systems. They're looking for different, novel, innovative solutions for detecting diversion. And with KITT Check, they have really the leading technology to address this problem. So we're very excited.
That's awesome. And so how did you guys find them? Tell me a little bit about how this went about.
That's a good question, Jessica. I mean, we've been looking at technology solutions, and that's part of the landscape of technology. And what I do at Omnicell as head of strategy and BD is always landscaping technology. Mm-hmm. And so we learned about KITT Check probably about 6 years ago, and we were just monitoring them as they were just founded as a garage out of Kevin McDonald's garage. And then he started to get bootstrapped and got funding from VCs. And then over the years, Kevin and I would keep in touch, every JP Morgan, ASHP, and then now we thought, hey, you now have the best-in-class solution for diversion. Let's do something together.
I mean, that's an important place to start, I think, too, especially in this landscape right now. So, I mean, what else are you guys looking at in terms of augmenting your own technology? Because you guys are no slouches either when it comes to tech solutions. I mean, you're basically building the concept out of an autonomous pharmacy, integrating robotics in different ways, sensors and things like that. And so, I mean, like, what are you guys looking for when you look outward?
Yeah, that's a good question. Kind of the make, buy, or partner decision. Mm-hmm. We're a technology company, and we're always very proud of what we can develop and bring to market on our own. But we know that the autonomous pharmacy vision is really encompassing a lot of different areas of the hospital, of the health system, across the care continuum. So when it comes to a number of different technologies, software, hardware, we realize it's also about time to market. And so how can we get to the market faster? And though we can develop on our own, is there a better solution? Is there a better approach to the market? And we feel like with KITT Check, it was really a good partnership. Plus, it also helps that I've been keeping in touch with the company for the last 6 years.
Yeah, well, you kept them in an incubation period for a long enough time. You're moving at the speed of healthcare here. So I guess, for any of the other innovators who might be interested in getting into this space, this is a space that, this is my first time being involved in talking about pharmacy in terms of health system pharmacy. So, what is your advice out there for the innovators who might want to work with an Omnicell or a company like yours in terms of bringing in their more disruptive technology and folding it into what some of the larger companies might be doing from a technological standpoint? Do you have any good advice?
I do, and I say, the thing I would say for entrepreneurs getting into this space is, rather than starting with the technology or the product, try to figure out what is the problem you're trying to solve for the customers. And oftentimes when I look at companies that are trying to market themselves either as a partnership or to be bought or acquired by a strategic, they have an interesting technology approach, but the problem they're trying to solve is not big enough or is not critical enough for health system pharmacies, health systems in general. So think about the problem, how big of a problem, what is the problem you're trying to solve, and then start with the technology.
You want to clue us in on any of the big problems that Omnicell is trying to solve, so that I'm being cheeky, but I mean it. So as far as what you guys are looking at, when you look at what's next on this journey of fully automating the pharmacy within a health system, what other kinds of pain points do you have that need solving right now?
Yeah, I think it's really the central pharmacy is a really big area for us, and we're very excited about launching the XR2 robot as a service. And so right now, we feel like there's a lot of errors in central pharmacy, and that's a big problem for us to tackle. One of the areas that we want to really address with autonomous pharmacy vision is the amount of errors that take place in the health system pharmacy.
Yeah.
And by being able to really barcode track and all the medications that are received and then dispensed, we have a better way to track potential track errors.
All right. Is there anything in particular that you're really excited about from a tech standpoint? I mean, you kept KITT Check on the shelf for 6 years, right? So I mean, you had your eye on an emerging technology when it was emerging. So is there anything out there on the bleeding edge that you're excited about in terms of one day potentially being able to integrate it into pharmacy?
I would say in general, we're very excited about the intelligence layer. I think Omnicell, we were formed as an automation company with a lot of hardware, robotics, with a lot of software. But going forward, we're very excited about really the potential of AI, machine learning software solutions to add to Omnicell. And I think KITT Check is a good example of that.
Yeah.
But looking ahead, I think AI-based learning algorithms that I think can add to our intelligence layer will be really, really strong.
How do you think that's going to change pharmacy if you're able to do that?
I think that will get it to probably what we want to strive for is zero errors, reduce inventory reduction financials.
Yeah.
I think the thing that we really are losing sight of is that, like, for health systems, it's such a big problem, they don't know where to tackle. And right now, we've launched the intelligence layer to really provide dashboards and visibility for inventory, what they have, where they have, how much they're using. Right now, that's all really the flying blind.
Yeah.
So with an intelligence layer, that really can help health systems to figure that out.
Absolutely, and better patient care all around and everything. So great. Awesome. Thanks so much for joining us. It was a pleasure to talk with you, pick your brain a little bit about technology and what's coming next. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.